Now coming to genetic mutations in carcinoma pancreas. So the most common genetic mutation seen in carcinoma pancreas, that is KRAS, and in what percentage it is seen? It is seen in 95 to 100% of patients. KRAS followed by P16, and P16 mutation is seen in 82% of patients. After that it is P53, this is seen in 75%. After that it is DPC4, that is seen in 55% patients. 55% patients, that is DPC4, and after that it is BRCA2. BRCA2 mutation, you know, it is associated with, what is the problem in BRCA2? There is breast and ovarian cancer. BRCA2, apart from that, there is increased risk of carcinoma pancreas also. So BRCA2 mutation, it is seen in 7% patients. So two questions which are frequently asked. First, that what is the most common mutation seen in patients of carcinoma pancreas? It is KRAS. And what is the second most common mutation? That is P16. KRAS followed by P16. There are lots of questions which are asked in relation to genetic mutations. So see those important questions. So the first question, most common genetic mutation in carcinoma pancreas as well as cholangiocarcinoma. How to remember? Mnemonic is CRAP16. The mnemonic is CRAP16. So how to remember? Obviously, this is KRAS followed by P16 in both carcinoma pancreas as well as cholangiocarcinoma. Second is carcinoma gallbladder, and here the most common mutation is P53 followed by KRAS, P53 followed by KRAS followed by BRAF. And what's the most common mutation in carcinoma stomach? Here also it is P53 followed by COX2. COX2. So two important questions, that in carcinoma pancreas and in cholangiocarcinoma, most common mutation, it is KRAS. In carcinoma gallbladder and in carcinoma stomach, the most common mutation, that is P53. These are important questions. Now coming to the risk factors for carcinoma pancreas. See, there are only two established risk factors. First, smoking, and the second is hereditary factors. There are certain associations with carcinoma pancreas like diabetes mellitus, obesity and chronic pancreatitis. These are associations with carcinoma pancreas.